Okay, so as you can see, there's a lot of causes of tachycardia. And so the nurse has to be pretty knowledgeable about pathophysiology. I mean, when you think about what the causes of tachycardia are, there's so many. We talked about fever, and for that you'd give some antipyretics, but you wouldn't ignore the fact that the cause of the fever is a possible infection. So you got to do the workup. I mean, and as a nurse, frankly, you're kind of preemptively working this up on your own. You don't really want to call the doctor without a lot more information than just the patient's heart rate is 118. The doctor's going to ask you a whole bunch more questions. So kind of get your shit together, right? Kind of know your stuff. So if it's a fever, you gave antipyretics. If it's an infection, you gave antibiotics. If it's a shock, you gave fluids and vasopressors. If it's bleeding, you might have to do a blood transfusion, as well as volume expanders, whatever, right? So now let's talk about something a little bit more testy, right? We know that patients are out here doing a little bit of everything. Illegals and legals. So if we look at illegal drugs and we think about uppers, or we think about drugs that would make everything go up, or we think about opioids, many of them, which would make vital signs go down, then we have to look at two drugs in particular, which is cocaine and any kind of methamphetamine or crystal meth type of product. Those are just going to make the heart rate go up. In fact, those will also cause seizures. So we tell you with cocaine, all vital signs are up. So there you go. Everything would be up, not just the pulse, right? So we know that's an issue. But then also legal stuff, right? I have some patients who decided that, caffeine should be part of their bloodstream. And so they drink 16 cups of Diet Pepsi a day, or they take a coffee pot and at least down 2 of them by noon. Yeah, that's not good. And we have a lot of students in my class with 5-hour drinks and Monster this and latte that and espresso this. Well, I got to tell you, one after another like that is going to cause some serious tachycardia. We have even had patients come in which it was a little bit more like hidden what was going on with them. They were taking Lasix to lose weight, among other things. And, when you're dehydrated, your pulse will go up as well. And there you are with the Lasix doing your little weight loss program, which is crazy. And you're peeing your life away, so you're becoming dehydrated. So even simple dehydration can raise the pulse. But drugs in particular that are concerning are drugs that have the active ingredient pseudoephedrine. You may remember Sudafed was over the counter and then it was locked up because of crystal meth and God knows any number of things. But if you look on any drug package and you go and you see a pseudoephedrine part of the deal, well then the patient's pulse will go up. So make sure you ask about those things, especially coffee and caffeine drinks. Mountain Dew has more caffeine in it than probably 90% of drinks available in the soda pop department, okay? Lastly, I want to make sure you know that smoking. Did they just have a cigarette in the car? Yeah, that will cause tachycardia, because what does smoking do? It vasoconstricts that blood vessel for a whole hour. And your patient just had a cigarette before they got out of the car, coming into your hospital. So, you got to consider all of that. Lastly, there's always that thyroid disease. You know that if you're hypothyroid, it's slow, low, and cold. If you are like me and you're hyperthyroid, not Hashimoto's and slow, but hyper, then you have Graves' disease, and that person's always like fast. So when I had thyroid disease, before I actually got it treated, I of course had tachycardia. And, I didn't really even think about it. And I remember people even saying that I'd be really flushed, like all through here I would be red, because tachycardic patients can be very flushed, depending on the cause, right? Now, so I wanted to just kind of put that in there because we know thyroid disease is very alive and well in most populations in America. So, you got to think about that. My other thing about that whole thyroid disease is don't forget the medication that we use to treat the patient that's hypothyroid or in my case, the medicine that we would use to treat the patient that had radiation or surgery. I had radiation on my thyroid, so I'm on Synthroid till I die, right? Well, you know, I have my times where I may have taken, just between you and me, by mistake, 2 Synthroid. Yeah, don't ask, just assume that I got issues, okay? You know, if your patient forgot whether or not they took it and they took it again, Synthroid is going to give you the same symptoms of hyperthyroid. Hope this helped. Hope you're doing good. Hope you're learning. Ask your friends to join. We want to help them learn as well. Next week, we will be doing a lot with SVTs. Remember I said SVTs was a heart rate that is like greater than 150. Now, let me just say a couple things about the treatment for someone with tachycardia that's like idiopathic, like we don't know what the cause is, or bradycardia, more likely, as well as SVTs. We know that pacemakers are the maintenance model, if you will, maintenance procedure for a bradycardia. So next week we'll touch base on pacemakers, and then we'll dive into some heart block. Talk to you soon.